COVID worries and concerns that's gripped the country. Let me tell you, 13 deaths have been reported in India so far, largely those with comorbidities, but one man died at the age of 40 today. And he had no comorbidities, there were no underlying health conditions. He was admitted to the hospital in a severe condition where he had acute respiratory illness, and 2 days into being at the hospital, he succumbed. I'm going to take you through all the details here. We're looking at 3 years later. As much as we thought COVID was done, COVID seems to be back in our lives. India is once again in the grip of a fresh wave. It's being fueled by a new and fast-spreading variant that has now shown up in the United States and across Asia. In the last 24 hours alone, India has reported 13 COVID deaths, the highest daily toll in nearly a year. Among them, a 40-year-old man from Chandigarh with no comorbidities who died just 2 days after being admitted with acute respiratory distress. In Chennai, in the last 24 hours, a 60-year-old man has died. He had multiple underlying conditions. He succumbed to COVID. In Maharashtra as well, today, a 67-year-old man from Dombivli who was unvaccinated, again he had pre-existing health conditions, has passed away. Health officials though insist there's nothing to panic as yet. The warnings are loud and clear though. COVID positive patients must isolate. Masks are back. Hospitals are currently on alert. What's raising eyebrows though is the variant that's now seeing a spike. That's the NB181 strain, which is also spreading globally. In the United States, that it's being detected, health experts say could be very risky for young children. First spotted among travelers in California, Virginia and New York. In fact, the NB181 variant is now driving a fresh hospitalization surge, not just in the United States, in China, Hong Kong, of course, cases have been rampant there. They're the worst hit. Over 80 severe cases have been reported in just 4 weeks, 30 of them fatal. Most among them are seniors, though United States say many infants too have been infected. In India as well, we're looking at similar claims that several children have been infected. In Bengaluru, there have been cases of infants who've got COVID-19. Now, let me take you through the symptoms. As you see there very clearly, the NB181 symptoms include persistent cough, sore throat, fever, body ache, fatigue. In fact, some patients also report difficulty in breathing and loss of appetite. While Hong Kong officials have downplayed the variant's severity, US, though, on the contrary, scientists disagree, saying that there is a spike in hospitalization as well with this very variant. The virologist Subhash Verma in the United States confirms that this one is the one spreading much faster than previous variants. So here's what's changed. Despite rising threats, the CDC, United States, has updated its guidance, saying that healthy children and pregnant women do not need COVID vaccinations anymore, but isolation masking is mandatory. Trump administration, on its part, is proposing to restrict annual boosters only to seniors and high-risk groups, basically saying that children with good immunity do not need it. So they've reworked on their guidelines, saying that vaccination for young children not really mandatory, but at the same time, for senior citizens, it's all the more imperative that they are vaccinated. This, of course, raises multiple questions here. Are public health agencies in India at this point really stepping up? We hope not to see what we saw the years gone by. Multiple waves of COVID. This again seems like deja vu. Just hope that we are prepared. Hospitals are gearing up, but you and I are equally responsible. Isolate, wear your masks at public spaces.